हेलो डियर बच्चों, मेरा नाम है राहुल चक और मैं आपका बहुत बहुत स्वागत करता हूँ अपने यूट्यूब चैनल फार्मावर्स पे। आज हम देखेंगे टॉपिक हाइपरटेंशन जो कि फार्माकोलॉजी से एसोसिएटेड है। इसके बारे में इसका इंट्रोडक्शन, कॉजेस, कॉम्प्लिकेशन, साइड इफेक्ट्स, फार्माकोलॉजिकल अप्रोच एंड नॉन फार्माकोलॉजिकल अप्रोच। And in the end, we will going to see some important top 10 high yield exam question objective based that will help you to give a clarity on this topic. So without wasting any further time, let's get started. सो पहले हाइपरटेंशन पढ़ने से पहले हमें ये समझना बहुत ज़रूरी है कि ब्लड प्रेशर क्या होता है। सो ब्लड प्रेशर को अगर हम सिंपल डेफिनेशन के अकॉर्डिंग हम समझे तो इसे हम ऐसे कह सकते हैं कि इट्स अ फोर्स ऑफ द ब्लड दैट पुश अगेंस्ट द वॉल्स ऑफ योर आर्टरीज। ऐसे कह सकते हैं कि ब्लड पाइप्स एज योर हार्ट पंप्स। ये दो तरह का होता है, सिस्टोलिक एंड डायस्टोलिक। सिस्टोलिक को हम ऐसे कह सकते हैं कि इट इज़ अ प्रेशर जब व्हेन द हार्ट स्क्वीजेस और द कॉन्ट्रैक्ट्स, और डायस्टोलिक वो होता है व्हेन द प्रेशर व्हेन द हार्ट रिलैक्सेस। इसको नॉर्मली मेजर किया जाता है इन यूनिट दैट इज mmHg, मिलीमीटर ऑफ मरकरी। नाउ अब हम समझेंगे व्हाट इज हाइपरटेंशन, जो हमारा मेन सब्जेक्ट है, जो हमारा मेन टॉपिक है आज का। In simple definition, it can be defined as it is a disease where your blood pressure is too high for a long period of time. इसको हम ऐसे समझ सकते हैं कि think of a garden hose like it's a flexible tube. Hose means flexible tube. जैसे कि अगर आपने if you turn the water pressure too high for hours or days, तो जो flexible tube है it can become stiff, leak or burst after a particular period of time. सेम चीज हमारे आर्टरीज के साथ भी लागू होती है। And the hypertension is very well known as silent killer because इसके कोई symptoms नहीं होते, it has usually zero symptoms until it damages the heart, brains and the kidneys. core concept जो हमने अभी पढ़ा hypertension, इसका basically the core concept क्या है? So the heart, like the heart, हम इसको ऐसे समझ सकते हैं कि it is a central power engine of the body that is responsible for pumping the blood throughout your body. The vessels are the high speed highways that are responsible for distributing the blood that has been pumped by the heart. And this hypertension is basically a state of a structural overload where the pressure inside the highways threatens to tear down the entire system. So the battle matrix, this is according to the latest ACC or AHA guidelines. Basically, ACC stands for American College of Cardiology and AHA stands for American Heart Association guidelines. These are the latest guidelines. So we measure this hypertension in mm/Hg using the two crucial numbers. The first is normal. That is, when we say it's normal, it can be defined as less than 120 or like 80 mm/Hg. System operating its perfect harmony, मतलब it's perfect है। एलिवेटेड हमें कह सकते हैं, एलिवेटेड कब बोल सकते हैं, व्हेन इट्स 120 to 129 systolic and less than 80 diastolic. It's like the warning alarms are softly buzzing. Then stage 1 hypertension, 130 to 139 systolic pressure or 80 to 89 diastolic pressure. The walls are taking light but continuous damage. Then stage 2 hypertension, 140 or more than 140 systolic pressure or 90 or more than 90 diastolic pressure. It's a critical strain and immediate intervention is very much needed. And last, hypertensive crisis. If the systolic pressure is more than 180 and or if the diastolic pressure is more than 120, it's a code red situation and we have to act immediately, which as it can act directly on organ and can cause the damage. Causes and the risk, like profiling the enemy or to determine the etiology of it. So basically it has been divided into two types, essential versus secondary hypertension. When we say essential, it is also called as primary hypertension and it occurs in most of the cases, like 95% of the cases. But with respect to the diagnosis, we can say the pressure creeps up slowly over the decades and the cause is basically still no single villain, and it is an accumulation of a group of factors which includes genetic traits, aging and the lifestyle habit. When we talk about secondary hypertension, जो कि mostly 5% of cases में होती है, कम होती है, diagnosis उसको हम ऐसे कह सकते हैं कि it's a sudden violent spike in the blood pressure, और इसका cause जो है it's basically a specific internal saboteur. Usually it's caused by a kidney diseases or an overactive adrenal gland. So by it's I have written mnemonic like the press. It's a basically tell you about the risk profile, like how do we memorize the risk factor for the exam day. Like इसको आप ऐसा समझिए, P stands for poor habits, for example excessive dietary salt, tobacco use या heavy alcohol intake. आर से आप ऐसे समझ सकते हैं रेस एंड एज. फॉर एग्जाम्पल जो एडवांस विद एज या विद एडवांस एज और जो ब्लैक हेरिटेज कैरी अ स्टैटिस्टिकली हायर रिस्क ऑफ प्रोफाइल्स. E stands for evolution and genetics. A strong, unchangeable family history of cardiovascular diseases. When we say S stands for sedentary lifestyle, lack of physical movement that weakens the heart efficacy with time. And last is S, that is size, living with a higher body mass index, that is BMI or obesity. Now, the complications that are associated with it, as we know, it's a silent assassin. The first and the the most important thing that makes it complicated is the zero symptom mask. Like as we know that it is called as a silent killer, it's commonly known as a silent killer. Patient routinely walks around feeling entirely healthy, while the high blood pressure micro damages delicate tissue structures every single second. So we have to very much cautiously understand this thing. Organ that gets damaged with this is, if left untreated for a long period of time, chronic hypertension can create a catastrophic system failures across the pharmaverse. The first is the brain. Vessels rupture or clog, it can cause or it can lead to a stroke. The heart, overworked muscle leads to myocardial infarction, heart attack or heart failure. The kidneys, जो हाई प्रेशर है shreds the nephron filters resulting in CKD जो कि होता है chronic kidney disease. And the eyes, these are the delicate retinal pathways burst and can cause hypertensive retinopathy, and it can also cause vision loss, and it's permanent. Like the pharmacological approach that we can go for to treat this condition, to treat the hypertension. So when the lifestyle modifications are not enough, so we deploy our primary pharmacological frontline workers or the defense forces, and इसको हम ऐसे याद रख सकते हैं A, B, C, D. So when we say A, it basically means ACE inhibitors and ARBs, जो कि they are the we can also call as them the vasodilators. सफिक्स आइडेंटिफायर्स, लाइक फॉर एग्जांपल जब हम एस इनहिबिटर्स की बात करते हैं तो लास्ट में जो ड्रग्स होती हैं जैसे लिसिनोप्रिल हो गई, एनेलाप्रिल हो गई, रैमिप्रिल हो गई, कैप्टोप्रिल हो गई, तो मोस्ट ऑफ द एस इनहिबिटर्स के सफिक्स मतलब जो लास्ट में प्रिल लगा होता है, वाइल एआरबीज के लास्ट में सार्टन लगा होता है, जैसे कि लोसार्टन, वेलसार्टन, टेलमिसार्टन, ओल्मिसार्टन. इनका मैकेनिज्म होता है, दे बेसिकली हॉल्ट द रेनिन एंजियोटेंसिन एल्डोस्टेरोन सिस्टम, दैट इज रास. दे स्टॉप द एंजियोटेंसिन 2, जो कि एक द मोस्ट पोटेंट नेचुरल वेसोकंस्ट्रिक्टर होता है फ्रॉम नैरोइंग द हाईवे और द ब्लड वेसल्स और द आर्टरीज. ना सेकंड इज बी, दैट स्टैंड फॉर बीटा ब्लॉकर, द कार्डियक कार्मर्स. इसको हम ऐसे कह सकते हैं, सफिक्स से ऐसे पहचान सकते हैं जिसके पीछे ओलॉल लगा हो. फॉर एग्जांपल मेटोप्रोलॉल, एटिनोलॉल, बिसोप्रोल, बिसोप्रोलॉल, प्रोपेनोलॉल. इसका मैकेनिज्म होता है, दे ब्लॉक द बीटा 1 रिसेप्टर्स ऑन द हार्ट and this slows down the heart rate and drops the force of the contraction. The third is calcium, मतलब C, that is calcium channel blockers. These are also called as the smooth muscle relaxer. इसको हम ऐसे आइडेंटिफाई कर सकते हैं इसको ऐसे आइडेंटिफाई कर सकते हैं बाय डिपीन, लाइक एम्ब्लोडिपीन, नाइफ डिपीन, फेलोडिपीन. ये बेसिकली ये जो मैंने आपको बताया ये बेसिकली डाइहाइड्रोपिरिडीन डेरिवेटिव है. कैल्शियम चैनल ब्लॉकर्स के अंदर नॉन डाइहाइड्रोपिरिडीन डेरिवेटिव्स भी आते हैं, जैसे कि वेरापिमिल या डिल्टियाजम, बट फिलहाल मैं यहाँ पे सिर्फ डाइहाइड्रोपिरिडीन डेरिवेटिव्स की ही बात कर रहा हूँ. तो इसका मैकेनिज्म बेसिकली ये होता है, दे स्टॉप द कैल्शियम from entering the vascular smooth muscle cells. No calcium means no muscle contraction, forcing the blood vessels to open widely. Now the last D, that is the thiazide diuretics, and these are called as the volume depleters. So basically जो इसको हम identify कर सकते हैं by suffix identifier can be thiazide. Like example hydrochlorothiazide. Mechanism basically we can say they block the sodium reabsorption in the kidney distal convoluted tubule DCT. The body excretes the salt and the water and dropping the total blood volume. Now the side effect saboteur, that is basically tell you about कि इन चीजों के side effects क्या होते हैं. Like every pharmacy exam tests the unique adverse drug reactions of these classes. For example, when we talk about ACE inhibitors, तो इसके केस में मोस्ट कॉमन साइड इफेक्ट इज अ ड्राई कफ और एंजियोएडेमा, दैट इज सीवियर स्वेलिंग। तो इसको हम बेसिकली ऐसे याद रख सकते हैं, एस इनहिबिटर्स एस निमोनिक से ही। ए स्टैंड्स फॉर एंजियोएडेमा, सी स्टैंड्स फॉर कफ एंड ई स्टैंड्स फॉर एलिवेटेड पोटेशियम लेवल्स। When we talk about calcium channel blocker, we can say कि इनका most common होता है, it can cause the peripheral edema, that is swollen ankles. And amlodipine is very much has a common side effect of pedal edema. Calcium makes fluid pool in the feet like water leaking at the base of the castle walls. And then thiazide diuretics में हम ऐसे याद रखते हैं, it can cause hyperuricemia, मतलब excess of uric acid in blood, and it can trigger gout and hypokalemia, that is low potassium level in blood. Contraindications, like when not to deploy the heroes, like when not to deploy the ABCD, ACE inhibitors or ARBs, beta blockers, calcium channel blockers, or diuretics. In pregnancy, never use ACE inhibitors or ARBs. They are teratogenic, like it can harm the fetus. And the tip for this is, like, if a pregnant patient has a hypertension, switch them to methyl dopa or labetalol, and they're considered to be as the safe shield drugs for the pregnancy instead of going to ACE inhibitors or ARBs. Strategy like non-pharmacological approach. So जो pharmacological approach होती है वो अपना बेस्ट तब दे पाती है जब उसे हम solid non pharmacological lifestyle की strategies के through implement कर सकें. Like we have to mix both pharmacological approach along with the non pharmacological approach. So the DASH protocol. So basically when we say DASH, it stands for dietary approaches to stop the hypertension. So the limit is, like, drop the daily sodium consumption below 1500 mg, like roughly around 2/3 of the teaspoon of salt. And the focus of this is like eat the foods which are rich in potassium, magnesium and calcium to naturally stabilize the vascular tone. And the physical conditioning, which is very much important, like the target for around is 150 minutes per week of moderate intensity aerobic exercise. And this simply can change and improve the arterial elasticity and can lower the blood pressure reading by 5 to 8 mm per hg without a single pill. So combining both pharmacological and non-pharmacological approach, we can obtain the best results in hypertension. Now, a quick scan or the master summary that I've told you about, like ACE inhibitors, suffix, pril, or sartan. The main action is to block the RAS and vasoconstriction, and real world visual we can understand like it widens a closed or a narrowed tunnel. Beta blocker, we can suffix is olol. The main action is decreases the heart rate and the force of the heart, and it can understand by easing of a racing car throttle. Calcium channel blockers, it can be uh, identified by suffix dipine, and main action is relaxes the atrial smooth muscles. And by real world visual, we can understand it by loosening a tightly tied rubber band. And in last, thiazide diuretics, by identifying by using a suffix called as thiazide, and the main action is flushes the water and the salt via urine. And the real world visual we can understand by this by opening a pressure release drain valve. So now we will going to talk about the top 10 high yield exam question that is basically associated with the topic hypertension. तो मैंने यहाँ पे 10 तरीके के अलग अलग तरीके के क्वेश्चंस मैंने यहाँ पे डाले हैं जिसमें आप आसानी से और कहीं ना कहीं बेहतर तरीके से हाइपरटेंशन के कंसेप्ट को और समझ सकते हैं. सो द फर्स्ट क्वेश्चन इज द ड्राई कफ स्विच. इसको सिचुएशन ये है कि a 52-year-old patient treated with lisinopril develops a persistent non-productive dry cough. Which of the following mechanism explains this side effect, and what is the best alternative therapy that is associated with it? Options are accumulation of angiotensin 2 and switch to metoprolol, accumulation of bradykinin, switch to losartan, that is an ARB angiotensin 2 receptor blocker, activation of beta 2 receptors, switch to amlodipine, that is a calcium channel blocker 1,4-dihydroprotein derivative, and depletion of substance P, switch to hydrochlorothiazide. So ACE inhibitors blocks the breakdown of bradykinin and leads to the accumulation in the lungs, which triggers the dry cough. So switching it to with ARB, that is angiotensin 2 receptor blocker, that is losartan, bypasses this problem, and because ARBs block the receptor directly without touching the bradykinin, so this problem, that is persistent and non-productive dry cough, will not come. Now the second question, question number 2, the pregnancy trap. A 28-year-old female patient in her second trimester of pregnancy presents with a high blood pressure of around 152/94 mmHg, which of the following antihypertensive agent is strictly contraindicated in this patient? So, as I have told you in the previous slides, like ACE inhibitors and ARBs should not be given in the case of pregnancy. So, options are methyl dopal, labetalol, enalapril, and nifedipine. So, answer is C, that is enalapril, that is an ACE inhibitors. So, ACE inhibitors or ARBs are strictly contraindicated with this when it comes to pregnancy, and it carries a black box warning for fetotoxicity, and it causes the kidney failure and skull defects in the fetus. So, and they are absolutely contraindicated in the pregnancies. So, option C, that is enalapril, is the right answer for this question. Now, question 3, the gout flare up. So, situation is a patient with a history of severe gouty arthritis requires a medication to manage their stage 1 hypertension. Which of the following frontline medications should be avoided or used with the extreme caution? Options are hydrochlorothiazide, lisinopril, losartan या metoprolol. So, जो thiazide diuretics होती हैं, they basically compete with the uric acids for the excretion in the kidneys, जो कि lead करता है high uric acid levels in the blood. That is a condition called as hyperuricemia, and which can precipitate a painful gout attack. So, option A, that is hydrochlorothiazide, is the right answer for this question. Now, the question 4, electrolyte emergency. So, situation is a student is reviewing lab results for a patient taking spironolactone, that is an aldosterone antagonist, and a potassium sparing diuretic, alongside with the ramipril, that is an ACE inhibitors. Which electrolyte imbalance must the pharmacist closely monitor? Options are hypokalemia, that is low potassium level in blood, hyperkalemia, um, excess of potassium in blood, hyponatremia, low sodium level in blood, and hypocalcemia, low calcium level in blood. So, जो ACE inhibitors होते हैं, जो potassium sparing diuretics होते हैं, they cause the body to retain the potassium. So, if we are using them together, they will exponentially increase the risk of severe hyperkalemia, that is high potassium, which can cause dangerous cardiac arrhythmias. So, option B, that is hyperkalemia, is the right answer for this question. क्वेश्चन फिफ्थ, दैट इज डायहाइड्रोपिरिडीन वर्सेस नॉन डायहाइड्रोपिरिडीन, मतलब कैल्शियम चैनल ब्लॉकर्स के जो सब टाइप्स होते हैं. Which of the following calcium channel blockers act primarily on the vascular smooth muscles to cause the vasodilation rather than directly slowing down the heart AV node, atrioventricular node? Options are verapamil, diltiazem, amlodipine, and propranolol. So, amlodipine is basically a dihydropyridine derivative calcium channel blocker, जो कि selectively targets the blood vessels, that is smooth muscles. While जो verapamil और diltiazem है, they are non-dihydropyridines, जो कि target करते हैं heart muscles and the conduction system directly. So, option C, that is amlodipine, which is a dihydropyridine calcium channel blocker, will be the right answer for this question. Sixth question, the diabetic shield. The situation is here, the question is, why are ACE inhibitors preferred as the initial therapy for the hypertensive patient who also suffer from type 1 or type 2 diabetes mellitus? Options दिए गए हैं, they directly lowers the blood glucose level, they increase the insulin sensitivity in the skeletal muscles, they dilate the afferent arterioles in the kidney, and reduces the protein excretion, proteinuria, and they prevent the diabetic neuropathy in the feet. So, by dilating the afferent arterioles, जो ACE inhibitors होते हैं, they basically directly lowers the pressure inside the kidneys filtering unit, that is glomerulus, and this will lead to the slow down the progression of diabetic nephropathy, that is kidney damage. So we can say option C, that is dilation of the afferent arterioles in the kidney and reducing the protein excretion, is the right answer for this question. Question 7, the ankle swelling complaint. And the situation is a patient starting a new hypertensive medication. That medication returns to the pharmacy complaining of swollen ankles and feet, but shows no sign of heart failure. Which drug is most likely the culprit of this? Atenolol, hydrochlorothiazide, amlodipine, and valsartan. तो जो एम्लोडिपिन होती है और जो अदर डायहाइड्रोपिरिडीन कैल्शियम चैनल ब्लॉकर्स होते हैं, they basically cause the significant precarpillary vasodilation. This shifts the fluid into the surrounding tissue and cause the edema or peripheral edema, that is an ankle swelling. So here the culprit drug is amlodipine, that is C. Question 8, abrupt withdrawal danger. The situation is A patient abruptly stopped taking their high dose clonidine, which is an alpha 2 agonist, because they ran out of refills. Okay, what severe withdrawal symptom is this patient at immediate risk of experiencing? Okay, options are profound hypotension and bradycardia, severe rebound hypertension and tachycardia, acute renal failure, या generalized tonic-clonic seizures. So basically जो clonidine है जो कि एक alpha 2 agonist है, they basically suppresses the sympathetic nervous system जो कि fight or flight response stimulate करता है, and stopping it suddenly it can cause a massive surge of catecholamines, that is adrenaline, leading to a dangerous rebound hypertension and a rapid heart rates. So we can say option B, that basically tells severe rebound hypertension and the tachycardia, very high heart rate is the right answer for this question. Now the question 9, the first dose hypotension. Which class of antihypertensive drug is notorious for causing significant first dose syncope? Means fainting or severe dizziness when standing up after the very first dose. Options are beta blocker, alpha blocker, prazosin, doxazosin, thiazide diuretics, or ARBs. So जो alpha 1 blockers होते हैं, they basically cause the rapid profound relaxation of both veins and arteries, जो कि sudden drop in venous return cause करता है into the heart upon standing and can cause orthostatic hypotension and fainting with the initial dose. So we can say option B, that is alpha 1 blocker, that is prazosin or doxazosin, is responsible for this first dose syncope phenomena or thing. And the last question of our today's session is question 10, compelling indications. According to the current clinical guidelines, which medication class should be avoided as a first line treatment for uncomplicated hypertension unless the patient has a specific compelling indication like a recent heart attack or myocardial infarction or a heart failure? ऑप्शन दिए गए हैं थायराइड डाययूरेटिक्स, कैल्शियम चैनल ब्लॉकर्स, बीटा ब्लॉकर्स एंड एस इनहिबिटर्स. सो क्लिनिकल स्टडीज ये दर्शाती हैं कि जो बीटा ब्लॉकर्स होते हैं दे आर लेस इफेक्टिव एट प्रिवेंटिंग द स्ट्रोक्स एज कंपेयर टू द स्टैंडर्ड फर्स्ट लाइन थेरेपीज जो कि हैं एस इनहिबिटर्स, एआरबीज, एंजियोटेंसिन 2 receptors blockers, calcium channel blockers, thiazides when treating simple uncomplicated hypertension. So basically they are reserved for the patients with the concurrent heart conditions. So option C, that is beta blockers, is the right question for this right answer for this question. So आज के लिए इतना ही. आई गेस मैंने जो क्वेश्चंस ये डाले हैं इससे आपको और क्लैरिटी मिली होगी ऑन द टॉपिक हाइपरटेंशन. बस आज के लिए इतना ही. थैंक यू.